Ladies and gentlemen, good evening, good afternoon. I'm Rose Kavari. I'm a urologist from Houston Methodist Hospital. I would like to thank the chair committee for allowing us to present our work on higher neurocorrelates following intravesical botulinum toxin A injection in patients with multiple sclerosis using a concurrent functional MRI and urodynamic studies. This is my disclosures. I do have Allergan funding, but that's for a separate research project. This project and this presentation is basically based on my K grant through NIH and NIDDK and some institutional funding. The original work that was done by Pittsburgh Group has actually allowed us to look at the supraspinal areas that are responsible for the micturition cycle. They identified areas in the brain after the afferent fibers bring the message to the preaqueductal grape, being processed in the insula, prefrontal cortex, and then relayed back to the cingulate gyrus, and then back to the preaqueductal grape, which all that information is processed, and then the signal is initiated from the Pontine Micturition Center. So we took this information a step further and decided to look at patients who are abnormal voiders. We decided to look at patients with neurogenic bladder, and the first group that we chose were patients with multiple sclerosis. As we had heard today, botulinum toxin A injection is a very well-described treatment for neurogenic detrusor overactivity, and its effect on the detrusor muscle is very well studied and very well known. However, its sensory effect is really not well studied, at least in humans. There are animal literature that supports that the Botox does have some sensory effect, either at the urothelium level or at the suburothelium or even the detrusor or in the nerves that retrograde transport the Botox. Therefore, we had an aim to look at to study the higher neurocorrelates following intravesical Botox injection in patients with multiple sclerosis using the concurrent functional magnetic resonance imaging and urodynamic studies. We chose patients who were ambulatory females with MS and documented NDO. This was an IRB-approved study, and we looked at the time frame at full urge. We studied these patients pre and post Botox 6 to 8 weeks after the injection of the Botox. This is our setup. In our protocol, we are actually able to allow the patients to void, and they do void spontaneously using absorbent pads and a wedge-shaped pillow underneath their knees, and all the tubes and everything is transported and exited out of the scanner to the control room, which is next door to the scanner. And this is our protocol where we do anatomical scans followed by functional scans. When the functional MRI part actually has 4 cycles that we fill the bladder, allow the patient to void, and we fill it again up to 4 times. This is our result. At this point, we had 4 patients, and this is the pre and the post subtracted for each patient, and I'm going to blow up this image and show you the difference. So this is the average out of those 4 patients pre and post. If you can see, the red areas are the more activated or highlighted with increased bold response. We have higher response in the cingulate gyrus, anterior cingulate gyrus, some in the pons and in the cerebellum. However, in the prefrontal cortex, it does look like after the treatment with Botox, it did become more deactivated or less activated. Basically, for the first time, we were able to look at some of these brain-bladder connections in patients with MS and lower urinary tract symptoms. We are going to present our data actually tomorrow on that series. We're able to show some changes in the brains of these patients affected with MS and NDO who responded to Botox injections. And we believe that being able to look at this data at the higher at the neuronal level, at the CNS level, may allow us to provide some more novel clinical and translational research for this patient population. This is a normal, healthy patient, actually just looking from above with 4 cycles of filling and voiding spontaneously, so it's matched with the urodynamics for that patient. And this is just for the sake of just showing nice video, but you can see how much change goes during our brain, during the filling and the voiding in cycles. Thank you.
Very good. Questions, comments? How do you check for confounders from the spinal cord lesions in MS patients?
We tried to choose as homogeneous a population as we could in the MS. So all the patients who had spinal cord lesions or pons lesions were excluded. All the patients who had cortical atrophy were excluded. These were like a more spontaneously voiding MS patients who were ambulatory. And we did exclude the ones that they had at the baseline on their anatomical scans, lesions in their spinal cord.
And what does those changes in those regions now tell you about bladder function?
So based on our original series that we just looked at, the MS patients without the Botox, these patients did have NDO, and their brain actually, just overall, again, we have such limited number of patients, we can't really be specific, but overall, the bladder was more quiet when we compared it to our healthy, normal patients at full urge or at the initiation of the voiding. And then when we treated them in this very select population with the Botox, their brain became more activated or more similar to the normal healthy group that we had. Again, very limited numbers. This is just, so we can't comment on that too much, but we do see some changes.
Very good. Thank you very much for your presentation. Thank you, everybody. This was the last presentation. Good afternoon.